the White House now seemingly focused on tax reform and disaster relief rather than health care. What do we make of the healthcare companies that rely on some federal spending to turn a profit? Companies like Centene, the provider of healthcare plans to beneficiaries from government-sponsored programs, mainly Medicare and Medicaid, as well as the Obamacare exchanges. Although Centene stock sold off after the surprise Republican sweep back in November, this stock has caught fire this year. It's up more than 50% for 2017. Glad we stuck with this one. With most of these gains coming after the GOP's plan to repeal and replace the Affordable Care Act went up in smoke. Now, Obamacare still has its problems like rising premiums in regions with only a single insurance provider, but there's no denying that Centene has been a huge winner from this law, and they'll keep winning so long as health care stays off the agenda in Washington, or even, frankly, if it's just modified. We know the company's doing well because Centene just reported a major top and bottom line beat a month ago. Management raising its full-year sales and earnings forecast. So can the stock keep climbing? Let's dig deeper with Michael Neidorff. He's the chairman and CEO of Centene to learn more about his company and its prospects. Mr. Neidorff, welcome back to Mad Money. Good to see you, sir.
Thank you. It's wonderful to be here.
Oh, I'm so glad you're here. We had you before. Please sit down on satellite. It was great, but before that, you came in and you explained some things that people felt were accounting difficulties. They weren't. And it was a tremendous opportunity. Now I want to dispel another belief, which is that regardless of whether they repeal or replace, your company's in position to make a lot of money.
Well, I think we're doing very well. We said that it's a matter of how you manage the care that makes the difference. We're managing it. We have good networks. And we're also very local. We're very decentralized. So the local presidents, CEOs, are doing what has to happen in that particular state.
There's an interesting moment in the conference call where someone asked you, what does it mean to be the only provider in a state after so many have pulled out? You said it's a double-edged sword. What do you mean by that?
Well, what I mean is when we're the only one, we get the full risk, and I like that. You get you get the critically ill, you get the healthy, you get the whole thing. When there's competition, I like it because we show how good we are compared to them. So it's a balance. I like it both ways.
Okay. Now, I'm sure you're following the debate. Even though the debate goes on, there's just each state has something going on, and we should never think that everybody at the state level is held hostage by Washington. You're going after a lot of different states in the next year. Kansas, Missouri. I mean, these are big. Maryland just got.
No, it's working well. We continue to grow. We continue to add states. There's some RFPs we're responding to right now. It's a good segment, and the fix is so simple that it could be done very easily.
Well, you better explain it to us.
Yeah, I said that because I wanted to.
Okay, let's go.
Okay, what we would do, and what we've been recommending there, is drop the to 100% of the federal poverty level, the expansion from 138. Take the exchange and go from 100 to 350% of the federal poverty level with subsidies. You're now moving, that will cost you $15, $20 billion on a $3 trillion budget. Okay? Put in a copper plan, which is wellness, big deductible, and catastrophic care for the people like you, the young healthies. Okay? And so you do that.
You'll attract those people in the pool.
Yeah. And then I want a reinsurance, not a high-risk pool. And by reinsurance, we'll figure out the attachment point, 100 specific. But the health plan should be 80-20. So the health plan still has to manage the care. It's not a matter of just wiping your hands of it. You do that, it can really, and we pay in for some of the premium.
Well, okay, it's a simple fix seems to elude Washington. Is it because there are certain interests that would get hurt by what you just said?
I don't think anybody would get hurt. It's just they're trying to be all things to all people.
Yes.
They're trying to help the states and say to the states, you can do what you want. You have chrome plans and iron plans. I believe in keeping it simple.
Right. Now, one thing you're asked, which is that someone asked about Spinraza, but what do? We have all these orphan drug companies come on, and they got $500,000, $700,000. Can't they wipe out a Centene program?
No, it's interesting. There was a product, 17P, which helps premature births. And somebody got it as an orphan, and they took it from what was like a $39 dose to a $1,700 per dose. So we talked to some pharmacists, and they compounded it.
So that you got if they compound it, you break the price.
And the physicians liked it better because it didn't have as many preservatives in it. So, the point is, when there are issues, it's our job to figure out what's an alternative. Always, what's the highest quality alternative?
Right.
Quality first.
Well, you've done a remarkable job, and I'm confident that your company will continue to make money regardless of what Washington does. That's Michael Neidorff. He's the chairman, president, and CEO of Centene Corporation, CNC. Read the conference call. You will understand why these guys don't lose money. They make money, and they also provide quality care. Stick with Cramer. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.